So you're probably wondering what happened to Peter. Well, Peter's H. pylori fecal antigen test came back negative. So this should pretty much rule out H. pylori infection as a cause for his abdominal pain. And the reason for that is that, remember, the H. pylori fecal antigen test performed very well compared to the gold standard, the EGD with biopsy gold standard that was used by the Italian team in the paper that you appraised. It gave a sensitivity of 0.97 and a specificity of 0.98. And that produces a likelihood ratio, a positive likelihood ratio we call it really, of 50. So let's just look at our old friend the nomogram, the likelihood ratio nomogram again, to review how that high likelihood ratio of 50 really helps us. So even if the team thought that Peter's chance was only about 10% of having H. pylori as a cause for his abdominal pain before they did the test, if the test had come back positive, it would have raised the post-test likelihood to 85%, and they would have pretty much treated him at that point. And if they'd thought he had a pretty good chance of having H. pylori beforehand, a positive test would have pretty much been a slam dunk. So that's why we call the H. pylori fecal antigen test a spin, because if the test is positive, we know that the specificity is very high, and in that situation, if the test is positive, it basically rules in the diagnosis. But recall the specificity being high was true, of course, but also the sensitivity was very high. So we can actually calculate something else. This is called the negative likelihood ratio using these numbers. This formula is pretty much thus similar to the formula you know for the positive likelihood ratio, only it's sort of the inverse. So it's 1 minus the sensitivity divided by the specificity, or 0.03 divided by 0.98, which gives you 0.02. So this is what's called the negative likelihood ratio. So if we go back and look at the likelihood ratio nomogram again, using 0.02, if the test was negative, and even though the team might have thought Peter had a good chance of having H. pylori, it would have pretty much ruled out the diagnosis, since the post-test probability would be 1.5% or so. And even if they thought it was much more likely, with a negative test, they still probably should not have treated him for H. pylori. So H. pylori antigen, fecal antigen, is a snout because the sensitivity is so high that a negative test virtually rules out the diagnosis. And that's because any test with a sensitivity that high that is negative is likely to be a true negative, not a false negative. So H. pylori is both a spin and the H. pylori fecal antigen is both a spin and a snout. So it's a very helpful test. So what happened was Jen called back, or Dr. Heyman that is, called back the family practice doc who had referred Peter to the clinic and discussed the results with him, and they talked about managing Peter's abdominal pain in some other way than treating H. pylori. All in all, the team felt pretty good that they had answered the referring doc's question about the positive serum ELISA test, and felt on pretty strong footing that they now knew Peter did not have H. pylori, and knew a lot about the test as well. Hopefully you do too.